Right, let's get more on the Omicron variant now and find out more about exactly what kind of threat it could pose to us. I'm now joined by Professor Sir David Spiegelhalter, who is a leading statistician based at the University of Cambridge and the author of COVID by Numbers. Good morning, Professor Spiegelhalter.
Good morning.
What are the numbers telling us about the risk that we face from this new variant?
It's a very difficult situation because we haven't got a lot of data yet at all, almost nothing from this country about what the risks are. South Africa, there's data coming out showing pretty strong evidence of increased risk of transmission and some evidence about people going to hospital that it may actually be milder, but we haven't got enough data yet to be able to say. It doesn't look as if it's, really severe if you get it. I think that's about all we can say at the moment.
So at the moment, your view is keep calm and carry on to some extent.
Yeah, we're at a very tricky time. I mean, the policy has led to a very delicate balancing act for months, essentially, with high case rates and what apparently seem to be tolerable hospitalizations that have been coming down recently, and even deaths coming down. But a very strange situation where cases in young people are going up, especially in London. Cases in old people are still coming down, and that's the booster effect. Boosters we're being saved by boosters, essentially. They are extraordinarily effective. If you've had, double AstraZeneca and then Pfizer, you're more protected than you've ever been, right from the beginning, right from when you had the initial vaccinations. I know I shouldn't sell I'm a statistician, I collect data, but I do like stories as well. And somebody was tweeting out about their 93-year-old grandmother who got COVID, but she was triple vaxxed and she just had a runny nose. I know that's only one person, but we do know that they're saving very large numbers of lives. I think it's a real problem. First of all, there's a big push now to get boosters out. I'm not quite sure why we're only doing that now. It was so clear that these are the lifesavers. We had to get them out, but at last it's happening. But the benefits have been very poorly communicated. And if your hospitalization protective, your protection against going to hospital has dropped, say, from 97% to 91%. Well, it doesn't sound very much, does it? And topping that up, well, is that very important? But if you flip it round and look at your vulnerability, your relative vulnerability has gone from 3% to 9%. The opposite to the 97 and the 90, the 97 and the 91. Then that means your risk has gone up 3 times. So just that bit of waning has massively increased your risk. And I think if things were being communicated much more about that, and the fact that the boosters massively reduce your risk of hospitalization and death, then the take-up might be even stronger.
Well, I'm with you that statos ought to be allowed to tell more stories because statistics often tell us the greatest stories. But one story which I think we don't quite know the end to is this. Even if we are still just dealing with Delta, this winter, what do you estimate to be the bigger risk? Delta, COVID, or flu? What should we be more worried about?
Well, to be honest, flu is very low at the moment. Not as low as last year. It was almost none last year at all. But it is actually very low at the moment because we're still taking lots of protective measures. We're not mixing socially anything like as much as we have been normally in a normal winter where flu might kill 10, 20,000 people. So actually, it's great that everyone's been jabbed. I've had my flu jab, but flu at the moment does not look like the main risk over this winter, apart from COVID. I think the big risk over this winter, even before the new variant came along, was just the standard risk almost of the NHS over winter, which is the huge pressures that are on it, which we can see, and that's only made worse by COVID cases requiring more resources and, of course, the huge backlog that's built up because of the pandemic. So flu I don't think is such an issue over this winter.
What do you make of the story that's emerging this morning about the proportion of COVID beds that are being occupied by those who are unvaccinated. And I guess there are a couple of questions here, but to start with, is that really significant? 90% of the beds allocated to COVID, which are 20%, I think, of critical care beds, are occupied by people who are unvaccinated. Is that really a big issue, or is it marginal?
It's not true of hospitalizations. The majority of people in hospital with COVID have been vaccinated. And that's exactly what we'd expect when nearly everybody who is vulnerable to, particularly vulnerable to COVID, have been vaccinated. That's not saying the vaccines don't work, it's just saying they're not perfect. Intensive care is different because the people who go into intensive care are much younger than the standard person who's at risk with COVID and goes into hospital. They're highly selected, and in there, the majority of beds are unvaccinated. I personally, my opinion is, I think that's very unfortunate indeed that these people are not vaccinated, and they and their families might possibly be regretting that decision. But they have to be treated just like someone who smokes is treated in hospital like everybody else. And so there is a duty to treat them. But I think it's very unfortunate, and that any effort to increase the take-up of vaccines is valuable. And of course, that's both to protect people around you, but it is just to protect yourself.
Looking at the history of these things, do you think that there's a point at which you reach a sort of a ceiling on the levels of vaccination, and that there is always going to be, if you like, a recalcitrant minority that just won't have it? Absolutely.
You won't convince everybody. There'll always be some. There'll always be a small group of people, and in a way, to some extent, they take advantage of what the rest of the community are doing. I'm not really, I don't comment on policy. I think it'd be unfortunate, perhaps, if there was all the vaccinations made mandatory, though, because it makes martyrs out of people. And just every effort should be done to get people to volunteer to be vaccinated. But it won't cover everybody. No, that's impossible. And even if it did, even if we're all vaccinated, this virus is going to be circulating. It's not going to wipe out the virus. We're not going to reach that. And so, in fact, although it would be great if more were vaccinated, it's not like that's going to eliminate the epidemic.
Can we talk about the government's steps thus far? Looking back at what has been done in previous waves, we now have the travel ban, we have exhortations to behave in a commonsensical way, and so on. If what we fear about Omicron is true, is what's been done so far enough to stop it?
Again, I'm not going to say exactly what should be done, because I'm not an infectious disease expert. I'm not going to say, I wouldn't dream of saying what the policy should be. But as the previous interviewee said, it's best to be precautionary when there's so much we don't know. I mean, it really looks like this Omicron virus is more transmissible. We don't know whether that's because it's intrinsic property of the virus that makes it more transmissible, or whether it's because it can get around, the immunity people have got either from having previous infections or from vaccinations. So, and there's a wide range of different combinations of those that could still lead to more transmissibility. There's so much we don't know. And when we don't know, it's better to be safe than sorry. Now, what that means is another matter. This is just like last year with the Alpha variant, this is a terrible time for a variant to come along, when it's probably the next 2 weeks are probably some of the highest risk periods with a lot of indoor socializing that we know is extremely high risk. And so it's appalling timing. I'm sure the government would love not to disrupt Christmas. What happens after Christmas, of course, is another matter. I mean, the travel restrictions at the moment are only going to slow things up a little bit, possibly, or to some extent, but they're not going to stop it, and it's going to come in. And we obviously everyone will do their best to stop it spreading. But, the new year is quite likely to see some quite, a lot of challenges to face. And as SAGE have said, that could very well mean more stringent measures. I think I could mention working from home, which so far has not been recommended, but that is known to be extremely effective at halving the number of close contacts people have. And in the end, it's how close, it's how many people you're breathing over. I should say, if people want to go onto the British Medical Journal, we've just got a nice interactive animation there where you can click on a little image and show I'm wearing a mask, I'm singing, I'm 2 meters away, the other person's not wearing a mask. What's my risk of transmitting the virus if I've got it? And you can change all these things and see them wobbling around, and what is an effective measure. And I think that's quite informative. It's certainly actually changing my views of what perhaps I might do.
Well, that sounds like a good Sunday afternoon alternative to playing Fortnite. But just quickly, if I may ask you this, you've probably got a better fix than most on the progress of these things. In reality, have we just got to abandon the notion that this thing will go away, but accept that it will be endemic, that we are going to have to live with it in the same way that we live with flu?
I'm taking the judgment that other people have made, but yes, it's not going to go away. I don't think there's no way this could be eliminated. It's going to be spreading around. People have suggested this Omicron is the sort of an endemic variant that might just be, we might just have to, this is one we might have to live with for some time. And we're going to have to get used to it. And that could very well involve, as people have said, top up vaccines. I don't know. I get very sad at the thought of us, having to have, changing our mode of socializing and things like that, and traveling. So it's unclear what that will mean in terms of our lives, except I think we will be vaccinating, getting boosters for the foreseeable future.